to the City Council Stadium Authority joint meeting. And so I have all my fellow council members on the line right now. So we're going to start with reports of action taken in closed session. City Attorney.
Council took no reportable action in closed session.
All right, thank you. Next, we have continuances or exceptions. Does anyone have a continuance or exception? The City Council, public, or staff? No, not seeing any. I'm going to, before we go to special order of business, there's a couple things I'd like to say. First of all, good afternoon and welcome to today's City Council Stadium Authority meeting. The City of Santa Clara continues to take unprecedented steps as we comply with the County of Santa Clara's Public Health Department's order and guidance to prevent the spread of COVID-19. We are all practicing social distancing during this health emergency. I am the only elected official in the council chambers in person, while my colleagues have been calling into this meeting. You will also note that there are very few of us in the city council chambers, no more than 10 people at a time. We're all wearing face coverings at City Hall during this public meeting. I have mine here. I just took it off because I'm about 15 feet or more away from any individuals in the council chambers. For today's meeting, the city is implementing a Zoom feature to allow public participation from the safety of your home. Members of the public can join via the link and or call into the Zoom meeting displayed on the screen right now. If you would like to speak on an agenda item or during public presentations, please raise your hand on the Zoom application or press *9 on your phone. Please only raise your hand while the item you're seeking to speak on is being presented. The staff will enter your last name, or the last 4 digits of your phone number, and I will call you to speak. As a friendly reminder, members of the public have 2 minutes to speak on an agenda item and 3 minutes on the public presentations item. And those public presentations are topics that are not listed on the agenda. Prior to each agenda item, the staff will lower each hand to ensure the members of the public are requested to speak under the appropriate agenda item. You may also submit your comments on the e-comment feature available on the Santa Clara Legistar page or via public comment at santaclaraca.gov, and the comments will be read into the record. Our city cafeteria is open for members of the public so they can have the opportunity to speak if they do come into City Hall. We have implemented strict social distancing measures in the cafeteria as well. And in addition to our social distancing, all of us in city government have been practicing frequent hand washing and environmental cleaning, as the public health community has frequently reminded us to do so, and as we remind you to do so at home as well. I want to thank all Santa Clarans for their efforts in following this very serious following the very serious steps we are all taking as we shelter in place and only conduct essential activities that are critical for the health and safety of our community. So we'll move on to the council agenda. Okay. First item we have under special order of business is a verbal report from our city manager, Deanna Santana, regarding the COVID-19 pandemic. City manager.
Hi, thank you, Mayor. I just want to ask that my PowerPoint be brought up and shown on the screen. The county and Santa Clara, and as I'll get started as the PowerPoint's being brought up, the county of Santa Clara's revised shelter-in-place order went into effect about a week ago on May 4th and runs through the end of May. One of the changes under the May 4th order is that everyone, both employees and customers, are required to wear face coverings whenever at a business, even if it's an outdoor business. As I mentioned at our last update, city employees have been required to wear face coverings in the workplace for some time. This is all part of the Bay Area's effort to reduce the spread of the coronavirus. I'll update you on the FMS that was at the Santa Clara Convention Center. As you may have already read in the media reports, the Santa Clara Convention Center is undergoing a deep cleaning as the state-run federal medical station demobilized. The state as well as the county were involved in the decision to demobilize the FMS. Between April 5th through April 28th, a total of 20 patients were treated, and per local public health orders, the convention center will return to its normal operations, and it has been sanitized appropriately, and when it's appropriate to do so, we'll be able to implement the reopening. In terms of where we're at with COVID and Santa Clara specifically, the county is reporting as of May 11th that there are 2,341 COVID cases, 129 deaths, and 110 COVID cases within the city of Santa Clara particularly. I want to share a couple of slides, and then I'm going to hand off to our emergency services manager to report out on current state and county orders. If you can move to the next slide, please. I know that as we've been in shelter-in-place orders, there have been many questions that we have been receiving regarding reopening as well as the city's level of services. And I just want to reiterate that the City Council and the City Manager have no authority to relax the state or the county's public health orders concerning sheltering in place. During the pandemic, the city has not closed and continues to provide mission essential services to the community, such as supplemental food distribution as well as emergency center operations. Although a significant number of staff may not physically be in the office, the vast majority are continuing to work remotely. And if we can go to the next slide, that will demonstrate that anywhere between 95 to 100% of department staff are still working, either in the field or remotely or in the office. The slide provides a snapshot of the city's workforce and how many of us are using a hybrid model to continue to provide essential services. In fact, many of the departments, as we've been reporting and holding daily meetings, are sharing that there is an increased workload as staff now have to prepare to deliver its services under a COVID-safe environment and from the framework of protecting themselves, as well as the services that are provided. Examples are shown on this slide in terms of which departments are working 100% at 95% and under a hybrid model or under business as usual. In collaboration with the Departments of Human Resources, Information Technology, Public Works, Emergency Services, we are currently in the process of conducting advanced planning for long-term approaches to provide city services safely as the state of California begins to reopen. This will likely involve staggering shifts for employees, required appointments for services, increased remote working, permanent hand sanitizer stations, the use of plexiglass barriers between frontline employees and customers, as well as touchless payment systems and looking for other opportunities for the touchless delivery of services. I want to go to the next slide and just provide a brief update on the Small Business Assistance Grant Program. I can share that we have now provided 700 businesses and nonprofits that have applied a grant, and we are up to now 101 grants after 700 businesses and nonprofits applied, and that we have expended $730,000. And that this week we have gone through an additional 8 applications and are preparing to award the final $70,000, making for $800,000 fully spent. I also want to share that the Silicon Valley Central Chamber of Commerce launched a GoFundMe campaign to help raise additional funds for the city's grant program, And at last checking, they had raised about $1,500 for this program. I know that reopening is important for our community as well as our businesses, and I want to offer our emergency services manager an opportunity to speak on what's it going to take from the state and county framework to reopen. And then I want to just provide some additional updates on our food distribution program and other topics. So Lisa?
Lisa Schoenthal, are you on the line?
Yes, thank you. Thank you, City Manager Santana, and good afternoon, Mayor Gilmore and council
Afternoon.
members. This is Lisa Schoenthal. I'm adjusting to the delay here. So the slide showing Governor Newsom's roadmap is a good big picture of the state's strategy of 4 stages to ultimately ending the stay-at-home order. One takeaway from the roadmap is that the governor is moving away from terms like essential or non-essential that we are still using in Santa Clara County. And instead, the state is looking at risk. So it's lower risk, higher risk, no longer essential or mission essential. So in looking at this slide, we are at the beginning of stage 2 with the lessening of some restrictions in the April 29th order. The governor's guidance is deeper into stage 2. For example, today he released guidance for restaurants to open, and we are not there in the Bay Area, and especially in Santa Clara County. So this is a good big picture glance for the statewide perspective. Our county public health order is more strict right now, and we are required to follow the stricter orders as the governor has emphasized regularly. So if we could go to the next slide, please. So the next slide cites the specific California law, or in particular the Health and Safety Code, that empowers the local health officer with police powers, if you will. Specifically states the health officer may take any preventive measure that may be necessary to protect and preserve the public health from any public health hazard during any state of emergency. In this case, we're talking about a global pandemic. So for our sake, this is Dr. Sarah Cody, our Santa Clara County health officer. So this empowers her to issue orders that are enforceable, such as our current shelter-in-place order, and also ordering individuals to be quarantined, isolated, whatever preventive measures may be necessary. It's really very broad authority. California law empowers the local health officer. Next slide, please. So the next slide is very specific for our county. It lists the 5 indicators that need to be met before Dr. Cody will consider lessening the shelter-in-place order. So we are doing very well with indicators 1, 2, and 5, and I will review those. So indicator 1, the total number of cases in the community that is flat or decreasing. With the number of hospitalized patients, we're doing well. Our numbers are stable right now. Indicator 2, we have sufficient hospital capacity to meet the needs of our residents. So that is not just the hospital beds. It takes patients, equipment, it takes staff to treat the patients in the beds, as well as the necessary equipment and supplies. And indicator 2 is very closely tied to indicator 5 there, which is that we have at least a 30-day supply of personal protective equipment, or PPE, available for all healthcare providers. So all 11 of our hospitals have said that they have sufficient PPE right now. They've not yet self-certified that it's a 30-day supply, but at the moment, we are stable with indicators 1, 2, and 5. We're able to say we're stable and well with those 3. I'd like to draw attention to the left side of the slide where it mentions phased and focused reopening. Dr. Cody has emphasized possibly every time she has spoken publicly. Number one, any relaxation of shelter in place is risky. There is risk every time her orders are lessened. And number four, meeting all of these indicators when we meet them all does not necessarily mean that it will be the end of the entire shelter in place. So we're going to talk more about indicators 3 and 4 today more thoroughly, but Dr. Cody told the Board of Supervisors today that her goal is to go slow to make sure it's safe. So next slide, please. So the next slide zeroes in on indicator 3. Sufficient COVID-19 viral detection tests are being conducted each day. And so it's important to define what sufficient means. She has defined it for us as being 4,000 tests daily. Currently, we have 1,000 tests being conducted, approximately 1,000 tests approximately are being conducted daily in the county. So you can see we have a ways to go. However, the county does have a plan to increase testing, overcome the barriers they have identified. And the first very significant step to their plan is they have hired back Dr. Marty Fensterscheib, who was the previous county health officer, to lead this testing effort. Today is his third day, but he told the Board of Supervisors this afternoon that he is very optimistic the goal of 4,000 tests daily will be reached by the end of the month. They have significantly increased testing locations within the county, and those can be identified easily by going to our website, santaclaraca.gov/coronavirus updates. That's santaclaraca.gov/coronavirus updates. The testing locations have been underutilized, believe it or not. And so the county is messaging more about their availability, and our city does a great job with that, our city communications team. So it was encouraging to hear Dr. Fensterscheib today say that we're well on our way by the end of this month to reach that goal of 4,000 tests daily. Next slide, please. The next slide talks about indicator 4, and we are not well on our way at the moment for meeting indicator 4. And this is that we need to have sufficient case investigation, contact tracing, and isolation quarantine capacity. And sufficient, defined here, is for us to have the ability to contact trace 50 to 75 new cases daily, and the current capacity for contact tracing is 25 cases daily. So case investigation is very involved. It's a painstaking process. It involves determining how transmission occurred, contacting all potential contacts an infected person had. The county has retained a contractor to lead this case investigation indicator, and the goal for this contractor is to have 1,000 case and contact investigation staff fully trained by mid-July. This will include county and other public agency staff, community volunteers, and contract staff. It's very noteworthy that Dr. Cody and County Executive Jeff Smith sent a letter on May 7th to government and community partners asking for help to identify individuals in our organization, for example, to serve as disaster service workers. This would be a 6-month to a 1-year commitment. The letter identified the skills that they are looking for, and they are a very significant commitment of time. And these individuals would be interviewing cases, calling potential contacts, entering and managing data, identifying resources needed to ensure appropriate follow-up and compliance with isolation and quarantine. This is this is really what core public health does on an ongoing basis all the time with infectious disease. Given the scale of this and the 1,000 staff that are needed, it's an unprecedented need for personnel to conduct case investigation. So this concludes the slides.
Thank you, Lisa. I just want to go through a couple of other topics before I end the update. For our supplemental food distribution program, the need continues to present itself within our community. For our Healthy Meals Santa Clara program for children, we've distributed about 70,000 meals. For our senior nutrition program, we've distributed about 7,000 supplemental meals over an 8-week period. And we are still looking for donations through our Mission City Community Fund. I want to thank Healthy Meals partners, specifically Santa Clara Unified School District, Spectra Venue Management, Levy Premium Food Services, Intel, and California Great America. I also want to acknowledge late breaking, as I mentioned, Intel. A late breaking update is that they have provided and are ready to donate an additional 8,000 masks to the city. And so we'll be making preparations to receive that donation. At our last council meeting, the council directed that we follow up with Supervisor Ellenberg on her availability for May 12th. She was not available today, but she is interested in finding time on her calendar to come and present at either a later May or June council meeting, and we'll be making those arrangements and confirming the date sometime this week. And I also shared at our last update that we've been receiving a great coverage on our communication strategy on COVID in Santa Clara. We were featured again for our supplemental food distribution program in the New York Times, as well as our Santa Clara Has It Covered campaign will be featured in a National Public Communications Association called 3CMA. And it definitely demonstrates that we are being viewed in terms of our strength in communications and updating residents. In closing, we have been receiving a number of calls and emails from the county's revised shelter-in-place order, and I know many are anxious to return to work and reopen businesses. We certainly understand the experience locally and some of the frustration that it is causing. However, we are required to adhere to the state and county public health guidance and following the shelter orders. When it's appropriate for the city of Santa Clara to reopen under the public health protocols, we will be sure to keep both our employees as well as the public advised on how we will be reopening and taking more measures with respect to community venues and activities so that we continue to keep Santa Clara safe. This concludes my update, and I'm available to answer any questions that you may have.
Thank you, City Manager. I'll start with Councilmember Davis.
Thank you, Mayor. Can you hear me?
Yes.
Okay, great. I want to thank you, City Manager, for the report, and Lisa Schoenfeld, you're doing a great job, but I do have some questions about these indicators that you were talking about. So now we're not talking about essential, we're talking risk. And the indicators 3 and 4 that you kind of talked about, I was wondering how come the county has not really put a testing center in each of the 15 cities, so to speak, in the South Bay area, because we seem to know our people and public and how we can get people there, aside from, giving information to them a little bit more quicker. You did say that it is on our website and whatnot, but what about the people that aren't paying attention to a website? How do we get these people to these testings? Because you said it was underutilized. That was my first comment. I think that there's got to be a way of getting that a little bit better organized. Second, indicator number 4, if Jeff Smith wants to get these people to do a service commitment for a year or more, and you're looking at 1,000 staff, does he understand that there are budgetary restraints in each one of these cities, that they're having, COVID budget problems? So I'm wondering how you would select, city manager, these 1,000 staff people, not from our city alone, but people that you would have to have go into a training and also have them commit to a year. And how would that look in our city? I'm very curious on how you do that. And if they're hiring a contractor or a person to take this the lead, is that person going to come back and give us some kind of indication what this is all going to look like? And for the people that would like to do the job, what are the qualifications of? Because it seems like it's a lot of investigation, interviewing, IT, doing data entry, things of that nature. So I'm just curious what the county seems to, I don't know, I'm a little kind of concerned about how they dropped the ball. I mean, I heard that they wanted to do the tracing to help open up the country again, but it seemed to be introduced and then landed on the county, and now it's landed on us. So if anybody can clarify what this service worker would look like, how would you hire that person through the city? And if they want this all done by mid-July, that's a very short timeline. So could anybody answer any of these questions for me?
I will start on the second question, and then I will leave it to Lisa to, if she does know the answer on how the testing centers are selected. I don't know how the county has made its decision, and so I will leave that to her. For clarification, the county is entering in with a contractor that will bring 1,000 people of resources, and has asked the cities if we could offer additional resources for a 6 to 12-month term. Now, the request and the experience that they're looking for is someone who is very detail oriented, with keeping track of patterns and trends, and assisting with the contract tracing process. The issue, I think, is, as we've all acknowledged over, and particularly as we'll get into our budget later, is the state, the county, and the cities. We are all challenged and experiencing budget challenges right now. And so the sooner we get a solution on contract tracing, the sooner we can get reopened and put those processes in place. So that's part of the incentive, is getting indicators 3 and 4 resolved with resources, so that there's a higher level of guarantee of reopening, and reopening safely. And with the conversations with the county will continue this week, as well as on the out weeks, but particularly this week, we are scheduled to have more conversations specifically on contract tracing and how the process will look. So I don't have all the answers, but we are working towards them.
Okay, so in the future, you're going to update us on how this is
Yes.
all going? Okay,
Yes.
Thank you.
And Lisa, do you want to answer the question on the first question that Councilmember Davis asked, if you have any additional information?
Thank you, City Manager Santana. Well, these are very excellent questions, and it also highlights how the devil is in the details. So much of this appears to perhaps be conceptual at the moment. How the county selects testing locations, that's also an excellent question. I don't know the process for that. I know I was one of others who had asked for more locations, and they have actually, it's very good that they have expanded a number of locations. Pharmacies also have the option, if they choose, to offer COVID detection tests as well. I know we have, and we've learned incidentally that we had the Stanford Clinic on Mission College Boulevard can offer tests, and you don't have to have Stanford Health as your healthcare provider. So how they went about choosing, I can't answer. I don't know, but they do have a number of locations, and it seems to be increasing. And in a time when people are very cautious with saying anything positive, it was very encouraging to hear Dr. Marty Spencer-Scheib say today he was optimistic they would reach 4,000 tests by the end of this month. But as far as the qualifications and skills you asked about, they did provide a list of those. I could provide these now if you'd like to hear them now. They did provide a list of qualifications and skills they are looking for. And they did clarify yesterday that these would be employees that would be working remotely, but it is a very significant commitment during a time when fiscal challenges are widespread.
Okay, thank you. I just kind of think that for an opening, and it's undaunting, the amount of people and resources and things that have to be done to get this reopening to happen. But at the same time, we're in kind of a budgetary thing. So I'm just wondering, like, what kind of financial commitment they're looking for, or who's paying for this, and how is this going to happen? So if you're going to continue to update us, then, I would appreciate that, how this is going to continue to move. I know it's a moving target. I get that. But at the same time, I think people are curious as to where and when they can get these tests done, how it's going to affect them and their families. And so I'm just asking the questions as John Q. Public, so to speak. So thank you for the report. And I see that we're making progress, but I don't know. Let's see. Fight onward.
Thank you.
Thank you.
Councilmember Watanabe.
Sorry, I think I'm on mute. You can hear me now, right?
Yes.
Okay, thank you. Thank you very much, City Manager, for the report, and also Lisa for the additional report. I've got a couple of questions. City Manager, it's great to know how well the city programs have been received, and they're doing so well. And I appreciate you getting back about the county supervisor, Susan Ellenberg, being available maybe later on this month or next month. So we'll look forward to her coming to City Council. I had a question regarding what the city, depending on where we are with the shelter in place and how long this is going to go on for. I've had several residents inquire about, if we go into the summer or anywhere close to the summer and temperatures start to rise, if there will be the availability of cooling centers that, the cities are always great about providing to have a safe place for people to be during the day. Have we looked into anything like that, just planning ahead? I mean, I know there's so much to plan for, but has that been taken into consideration if our temperatures impact our residents?
No, in fact, we will have to add that to our advanced planning. I do want to acknowledge that just today, the city of Los Angeles announced that they would be sheltering in place through July. And so having learned that later in the afternoon, it's clear that we will have to make arrangements to, coupled with some of Dr. Cody's comments, not suggesting that we are going to shelter in place to July. I don't know that, but we do have to begin to make arrangements as you just inquired about. We have not, and we will add that to our advanced planning list.
Didn't want to add to your list of things to do, but it's just, I know it's something that we'll have to think about down the road. And for Lisa Schoenthal, regarding the Stanford Health Center that you mentioned, it's a testing center where they do the probe or to test for the COVID?
Yes.
Okay. And so that's great to know that it's basically right here in my backyard practically. But I'm just wondering, is it the kind of place that you have to make an appointment, or do you know? you have to have symptoms in order to get an appointment? Or
Thank,
you could,
thank you for the question, Councilmember Watanabe. We had EOC staff call last week. Actually, it might have been the week before last now, just to confirm. And symptoms are no longer required in order to be tested, but an appointment is necessary. So people do have to call first and make an appointment.
okay, that's great. Let me see, just let me look at my note. I was making notes also my thing here. I think that's all I have, but thank you so much for all of your dedication and all of your hard work. Just all of the city staff. I know how hard everybody is working to keep our city safe. So thank you very much, and it's very much appreciated. So that's all I have.
Thank you. Councilmember O'Neill?
Thank you. So, I guess my question is for Lisa Schoenfeld also. So the indicator 4 talks about sufficient case investigation, and it talks about need contact tracing for 50 to 75 new cases daily, and the current capacity is 25 cases daily. So I think right now, I haven't looked at it in the last few days, but we're below 25 new cases daily currently, aren't we?
Yes.
Is that correct? Okay. So, are they going to go back and like investigate the prior cases? Because I'm thinking if we're below 25 cases and we have capacity for 25 cases, shouldn't we be looked at, aren't we meeting the need there? I mean, I can see where you could build capacity going, like do training so that we hope it doesn't happen, but in the event that there's a spike again, later in the year, that people have been trained and, as Councilmember Davis is alluding to, like, where we're going to find people or where, because obviously the cities aren't going to have extra people. It's like, where are we going to find money to pay those people? But can you talk about if our caseload is currently really low, what are they really looking for there in terms of going back and I understand the concept of the contact tracing because we've all read about what a good job places like Korea and stuff have done with that.
Yes, well, thank you for the question, Councilmember O'Neill. It's reasonable to expect that as the shelter-in-place orders are relaxed and as contact among people increases, that there will be a surge in cases, that there will be more cases than what we currently have. It's very reasonable to expect that. It's very typical of infectious disease when mitigation measures are relaxed, that you have an increase, you have an increase in infection. So that's what they are planning for.
Okay, thank you.
Thank you. Councilmember Chahal?
Thank you, Mayor. Thank you, City Manager and Lisa, for the report. Appreciate that. Question for City Manager. We were looking at opportunity to expand our business grant program, and I'm not sure, City of Sunnyvale has recently announced their grant program, and I think they got a pretty good support from their businesses, and they already have a fund of around $1.3 million. Are we looking at expanding? Did we find any other more money to expand our program, whether from our sources or from donors like our big businesses?
So we have not heard from larger businesses for donations. We can double check with the chamber to see if they're working on such donations and such efforts. And as you can definitely, as if that's the council's desire, if you would like to increase the small business grant assistance program, you certainly can take that up. I'm sure that we could find some one-time funds. But it really is at the pleasure of the council if you would like to appropriate more. As I mentioned, we certainly have applications that we can certainly consider.
Right. And do we have some funds which you can suggest as of now?
There's the budget stabilization, which is a one-time source. But I would ask you all you can do it and consider it as part of the budget presentation that you will hear today. I'll
Okay.
find out.
Okay. And I do have a question or suggestion to Lisa. Um, as regards the testing facilities, some cities have done it on the city basis. I'm not sure how they've done it. I heard that Milpitas has done it, and then there was another one in Hayward or Union City, something they did it. We can look at that, how they did it, maybe, and explore if we can do something on that basis, basically. And
We have had an opportunity to do some research. The city of Fremont as well as the city of Hayward have provided at their cost some testing. I can share. I'm going by memory here. The city of Hayward expended about $3 million to promote testing. One is being able to acquire the testing and validate its reliability to make sure that the test that's being administered is reliable. But then also, as if the council wants to do that, then obviously we would need to create a funding source for it.
Oh, okay. And my last one is, as mentioned by Lisa, we do have some locations where the testing can be done. I would appreciate if we can put that information on our COVID-19 web page. That way our residents know if we need testing, there are a few places which are available to our residents over here.
Absolutely.
Thank you. Thank you. That's it.
Thank you, Councilmember Hall. So just a couple comments. First, talking about our small business fund, and it's great that we've been able to help over 100 businesses. I've heard from some of them how appreciative they are because many of them are just holding on as tightly as they can to try to get through this, and any help has been very much appreciated. So I would like to see, as we go through our budget process, if we can find any more funds in our budget to be able to help more businesses if we can. I saw that the chamber had a GoFundMe page, and it had $1,500, and those were from 3 chamber members, and we really appreciate that. But I think what we were hoping that the chamber would do would go out and talk to the big businesses. I don't see them putting donations on GoFundMe pages. That'd be from the smaller donations. But go out to the bigger businesses to see if the bigger businesses can help the smaller businesses. If they don't do that, I'm wondering, City Manager, if you can reach out to them to see if they're doing anything like that. I haven't heard that, but I'm hoping that that's what they were going to do with their connections to the larger businesses in our community. Maybe we can put together some kind of a team from the city to go out and try to do that ourselves if that's not in their plan. Because I think that there's untapped resources out there where the large can help the small, because we're all part of the same community. So I, like Councilmember Hall, would like to go ahead and see how we can further, get funds into the small business. Also, I've been on several calls with the county supervisors, with all the mayors and the different municipalities in the county, and with the county executive, telling everyone that we would like testing places here in the city of Santa Clara so that we can test our residents here as well. And I heard Lisa Schoenthal brought up the pharmacies, because apparently the pharmacists are qualified to be able to conduct these types of tests. And in the long run, that is the most convenient for our community, because we all have our local pharmacy that we can go to, and our local pharmacist that provides us, the help that we need. So we're doing what we can to try to get the testing here in the city of Santa Clara for our residents here. But I want to thank everyone for all of the updates. And I know our Lisa Schoenthal, city manager, and many of us have been trying to, look at the state's regulations and the county regulations and how they relate to our businesses here in Santa Clara, our places of worship here in Santa Clara. There's so many houses of faith that would like to get back to doing their, their business and have been, not able to because of either the state or the county. So it's been really tough, really rough around here, but I want to thank our staff. Everybody's been really helpful, and we're trying to help the community as much as we can. And one last thing is that I know the governor every day comes up with new opening opportunities for our community. So I want to make sure we've done a really good job of putting our news out every single day. We have to take all the language of the state and the county and sort of bring it down to, understandable level for our council and our community. What does that mean in real time for our businesses here? Because even the governor admits that everything that he talks about is so confusing to so many people, including him. So if we could, bring it down to a level that, they talked about strip malls, being able to open some strip malls and some stores and things like that, but it's only drive-through under certain conditions. So if we could, city manager and Lisa Schoenthal, come up with ways that we can easily tell our residents and our business residents, how they can operate in the city of Santa Clara.
Mayor?
Yes.
I just wanted to add, I do have some information. I know that the governor today in his order announced more information about what facilities are still not permitted. I can go through that list. It's a very quick list if you would like.
I think that would be helpful to people that are trying to go back to making a living.
Sure, this is right off of his announcement today. The following sectors, businesses, establishments, or activities are not permitted to operate in the state of California at this time. Personal services such as hair and nail salons, tattoo parlors, gyms and fitness studios, hospitality services such as bars, wineries, tasting rooms, and lounges, entertainment venues such as movie theaters, gaming facilities, and pro sport indoor museums, kids museums and gallery spaces, zoos and libraries, community centers, public pools, playgrounds, and picnic areas, religious services and cultural ceremonies, nightclubs, concert venues, live audience sports, and festivals. So he reiterated this message today in his order.
Okay, thank you. And I'm assuming we're going to put that on our website as well.
We will.
Okay, thank you. I have a member of the public. Is that for this particular item?
This is for this item, and this is a public member who submitted an email. So
An email. So would you like to read the email
Yes,
from
of
Diane
course.
Harrison?
I just listened to the COVID-19 report, but didn't hear anything about housing the homeless, and I've seen nothing in the daily reports. How is housing the homeless in Santa Clara progressing?
Either Deanna or Lisa Schoenthal? Did you hear the question about housing the homeless?
Yes, so we can answer more questions as part of the con plan update that is scheduled. There is some dollars that are being earmarked to the CDBG program for rental assistance, and we have been working with the county. They have purchased 2 locations. One is the Western Hotel, where they were housing the unhoused at that facility, and I'm drawing a blank on the second site, but I will research it by the time we get to the con plan update, unless Jonathan has it top of mind already. There were 2 hotels or motels that they purchased. So we are supporting the county's efforts in the programs and services and outreach to house the unhoused.
This is Lisa. I can add that the County Office of Supportive Housing is also working very dedicatedly addressing this challenge too.
And we're working with the county.
Yes.
You have anything else? Okay, all right. So thank you, everybody, for those reports. Those are always beneficial to our community to hear about all the efforts that are taking place. Okay, so next we're going to move on to our second special order of business, which is a proclamation of National Public Works Week 2020. So as a special order of business this evening, I would like to announce that May 17th through May 24th is National Public Works Week. The theme has been selected by the American Public Works Association, and this year is The Rhythm of Public Works. This theme encourages Santa Clara residents to think about our community as a symphony of essential services working in concert to create a great place to live. The City of Santa Clara has a dedicated staff that helps maintain and improve the city on a regular basis through public works. City staff delivers high-quality public works projects that help maintain and improve the city on a regular basis through public works. City staff delivers high-quality public works project that keeps the community's rhythm moving by providing an orchestra of infrastructure services in transportation, roadway and building maintenance, wastewater and storm water treatment, water and solid waste systems, parks, power, emergency management and first response, and other facilities essential to our citizens. So in honor of Public Works Week, I want to thank our staff in the Public Works, Silicon Valley Power, Water and Sewer Utilities, and Parks and Recreation Departments for all of their efforts in making the city the best it can be. So I have a proclamation here that I don't know who I'm going to present it to. I'll make sure someone in the Public Works Department, Silicon Valley Power, that everybody has a chance to see this, but on behalf of the City Council, thank you so much for everything you've done for us, especially during these critical and difficult times. So thank you. All right. Next, I have another special order of business that isn't on the agenda. So as a special order of business this evening, I would like to announce that last week, May 3rd through 9th, 2020,